budget. These will be brought forth for request later on. One additional full-time equivalent in social services. This is for the social services skills worker, providing therapeutic and community support services and adult rehabilitative mental health services, or ARMS. In the past, HDC and Ascend employed a team of therapy and therapeutic skills workers in Cook County. This would be a proposed addition to address the loss of staff that are providing the service locally through Ascend. Regional mental health grants and the potential for billable services would offset some of this funding. We are also budgeting for an on-call stipend for social workers. The purpose of this proposal would be to clarify the expectations of the social workers and case management staff for their availability and response to calls from Cook County Sheriff's Office outside of regular business hours. The policy and an hourly compensation for all on-call staff would assure a 24/7 response by qualified staff for response to statutorily required 24/7 reports, including child maltreatment and adult protection. This would support local law enforcement in responding to and referring necessary resources that improve the safety and well-being of the responders and the individuals in need. This budget also includes an hourly stipend for the in-home support services. The background for this need was recently presented to the board. A small hourly stipend is being requested to offset the low rates that our contracted providers receive while providing homemaking and chore services to residents in need. Without this important service, some residents may not be able to physically remain in their homes. Financial impact for a 2.5% COLA for PHHS is $50,713. This is the total change in payroll costs, since any change to the hourly rate would also affect our employer share of taxes, workers' comp, long-term disability insurance, and employer deferred comp costs. The employer deferred match cost. The 10% increase in health insurance would come to $47,842. The new position in social services would have to go through the personnel committee and be scored, so I estimated this position to be a grade 160 with a salary cost of $52,589 plus benefits, which would bring it up to the $84,073. $29,952 is budgeted for the on-call stipend for social workers, and the in-home support stipend is budgeted at an additional $2 an hour for an estimated 3,100 hours of service, or $6,200 for the year. While we can be very planful with our budget, we cannot precisely forecast the needs of the community next year and how many children or adults that may need temporary placement. Each year, we thoughtfully budget for potential out-of-home placement costs. However, due to early response successes in family services, we've seen less placements in recent years. Coupled with our increased revenue collection elsewhere, we've had a significant return to fund balance in the last 2 years. Therefore, our 2022 budget reflects a two-step approach to these potential costs. First, a reduction in the projected out-of-home placement costs, and a contingency for using up to $100,000 of fund balance if needed for children's out-of-home placements, children's mental health services, and adult placements. PHHS relies on levy funds to support our work. The state auditors have recommended that we hold a fund balance with a minimum of 42% of our budget. This ensures that we would be able to meet our obligations during the first 5 months of the year before property taxes are collected and other funding arrives. At the end of 2020, our fund balance in PHHS was $3.3 million. That's equal to 74% of this year's budget. So it's quite healthy. Planning to use $100,000 could reduce our fund balance to 73% of next year's budget, still well above the 42% minimum recommendation. The full cost of the COLA for PHHS employees is not reflected in this budget, as our payroll costs also generate additional state and federal revenue. This graph illustrates the impact of a 2.5% COLA on our budget. So in the highlighted line, you'll see our total budget without any COLA. Column 1 is our total expenditures. Column 2 is our total revenue. And then you see what the county cost and percentages in columns 3 and 4. So without any COLA, our levy change between 2021 and 22 would be 2.7%. The cost of a 2.5% COLA would increase our expenditures by $56,738. But because we receive additional revenue from state and federal for aid for our services, the actual impact to our budget is $50,713. The budget that we're requesting reflects just the net increase to the levy. The overall proposed budget is a 4.73% increase over 2021. However, by planning to use $100,000 of the healthy fund balance, if needed, for unbudgeted out-of-home placements, the levy increase is now 2.58% over 21. Income maintenance makes up 21% of our total cost. Social services is 62%, and 17% for public health. And looking at each of these areas, this is a summary of the expenditures, revenues, and net county costs by department. In addition to the COLA and health insurance increase for all employees, in income maintenance, we have one staff with more than 15 years who earns longevity. We reduce some of the reimbursable program costs, and with the reduced program spending, then there is a decrease in reimbursements. We have a net increase to the county of less than 7% for income maintenance. In social services, there are 2 staff who have more than 15 years and will earn longevity. We also included the new proposed position. As mentioned, we are reducing the projected cost of out-of-home placements and other program services. This results in a less than 1% increase in expenditures. Revenues are anticipated to be slightly higher due to the additional behavioral health funding for crisis response that we're going to be receiving. So overall, there is a net decrease in county cost of almost 1% over last year, which is this year. In public health, this year the temporary employment contracts expired and one permanent position was added. We also added additional contracts for the SHIP coordinator and the oral health task force contracts. These items were not in the 2021 budget, so the change from 22 reflects a 19% increase. Additionally, the Public Health Grant Fund received is budgeting for a 2% increase. This has been typical for the last couple of years. We will also see an increase in WIC and the local public health grants next year. This will increase revenue by almost 12%. So in public health, there will be an overall net increase in county costs of about 21% over the 2021 budget. At 65% of our budget, personnel is the largest expense for our 3 departments, as we are people serving people. 28% of the budget goes to direct program costs. These are things like the out-of-home placements, the public health grant fund, contracted services. Services and charges makes up 7% of our budgeted cost. This would be for staff training and travel, electronic data management software, Zoom and DocuSign licenses, and other administrative costs. Looking at our org chart, we do provide services. This is what we do, and it takes many educated and extremely dedicated staff to fulfill our stated mission. In this org chart, you'll see in the blue section on the left, in the first 2 columns, we have the adult and home and community-based services team. These staff provide adult services, adult protection, min-choices assessments, care coordination, developmental disability services, and in-home support coordination. Next, the Children and Family Services team. They provide intake services, parent support outreach program and licensing, case management in child protection and child welfare, children's mental health, adult mental health, therapeutic support services, substance use disorder and co-occurring disorder services. The red column in the center, this is our public health department, who in coordination with several local agencies have been incredibly busy keeping us all safe and educated. The 4th column you see, that's in green. This is the income maintenance or economic assistance department. They provide eligibility services for many state and federal programs, such as child care assistance, supplemental nutrition or SNAP, cash assistance, long-term care, health care options, and health care access coordination. At the top of our org chart, beginning with our director and scrolling down to the far right columns in black, this is the administrative team, providing internal and office support to all 3 departments, including contract management, paying invoices, billing and collections, budgeting, audit compliance, and grant reporting. And a few additional duties such as outpatient substance use treatment coordination, Social Security payee services, and fiscal coordination with FEMA. Above our director, there's a few more layers to our org chart with county administration, the PHHS board, and the advisory councils. Additionally, we have oversight of several federal, state, and local agencies such as DHS, Minnesota Department of Health, and our Community Health Board. I also included our contracted providers in the org chart. Without these partnerships, we would either need more staff or several important services simply would not be filled for our community, such as employment services and training, child support services, the in-home support program, substance use disorder assessments, referrals, and outpatient services, home health care, WIC, home visiting, oral health, child and teen checkup, outreach, and the statewide health improvement partnership. State and federal reimbursements equal more than 1/3 of our anticipated revenue. Fees for services and miscellaneous are typically payments from private health insurance for CD services, chemical health, senior health options, estate recoveries, and non-governmental grants and donations. That makes up the fees for services and miscellaneous. At 55%, county levy is the largest source of our funding. I want to draw your attention on a side note. In 2019, the levy made up 60% of our revenue budget. We are consistently searching for more grant opportunities, and we've greatly improved our third-party collections. Since we have not found a money tree in the forest, our staff have been working diligently to explore grant opportunities on a local, state, and national level. We've applied for several grants, but until those awards are decided, this potential revenue is not included in our budget. The HRSA grant has a potential funding of $22,000 for substance use disorder prevention, treatment, and recovery. The Healthy Housing Grant, possibly $102,000 for over a 21-month period for public health to promote healthy home environments in Cook County. The American Rescue Plan, potential for $83,000 to fund one of the existing public health educator positions. The CDC Workforce Development Grant is a statewide grant through the CHB to support COVID-19 prevention, preparedness, response, and recovery initiatives across the county. The Live Well at Home grant was applied for to purchase an accessibility vehicle that could be used by in-home support providers and care partners. Also, our county general fund receives federal aid based on certain costs that incur in PHHS. So any increased administrative costs that we incur, such as county IT support or rent that we pay to the county, this generates more federal aid that goes to the county general fund. In 2020, the county general fund received $121,000 in federal aid just based on our cost allocation plan. Additional state program funding will be available next year when we have qualified substance use disorder staff in place. Then we can begin the certification process with DHS and become eligible for this funding. Similarly, with the proposed ARMS skills worker, we would be able to bill for Medicaid eligible services with that as well. That was short and a lot of information, but I will take questions.
Thank you, Lori. Yeah, that's a lot of information. I appreciate all the work and what you sent in the packet. I know it takes a lot of time and effort to be so detailed here, and I want to express my appreciation. I have at home done my spreadsheet going back to 2015 and comparing how we've been doing over the years, and I just appreciated that this time in the budget, there was more detail of the services, and it wasn't all acronyms. It really helped me. Like, oh, that's where that is. So I know that takes a lot more effort, and it is hard to make it in a way that the public can understand, and I think you did a very good job of trying to balance the information and make it clear. So I do appreciate that.
Thank you.
Anybody have any questions for Lori? Commissioner Storley.
Thank you. Thank you, Lori. So what I printed out was really lots of details, as was indicated, but this was kind of a simpler way of looking at it. Is it possible to get that too, so I can translate it both ways?
The PowerPoint will be as part of the minutes.
Okay.
Yep, with all the slides.
For the next meeting, for the health meeting? Or when?
I don't know when the minutes get published.
Yeah, so we, since this is a special meeting, we'll include the minutes and the PowerPoint presentation for adoption at our next regular PHHS board meeting on the 17th. But if anyone wants an electronic copy in advance of that, we can get that to the board members.
Great, thank you. Yes, going back to 15 is a lot of information, and I have sporadically done it too, but this is a great improvement. It's a wonderful improvement, yes.
Thank you.
So where does the PPP money come in? I mean, did you reflect that anywhere that you got in the?
Do you mean the American Rescue Plan funding?
Yeah.
So we have not included that in our budget proposal for 2022, as there hasn't been any formal recommendation made by the commissioners or county administration as to the allocation of those dollars. So that was one of the opportunities on the money tree slide that Lori shared. So should we be granted those rescue plan funding dollars, that would further reduce our expenses and levy impact for 2022.
So you have received some, but you just have not reflected that right now?
We have not received any as a department. The county has received the allocation,
Right.
and we are intending to request short-term funding to
Okay.
help support our public health staffing costs while we pursue some additional revenue sources. So again, it's not reflected in our revenue or proposed budget for 2022 at this point.
And that'll take a while to get all that sorted out as to where all that goes. Okay, thank you.
Any other comments, questions? Yeah. Mr. Swallow?
Just when you went back on the opportunities, historically, and I recognize what's happened in the past doesn't necessarily reflect what's going to happen as we go forward, but historically, how have we done on being able to get grants and this type of thing?
I will say that with the exception of this last year, we've had staff that have had the ability to be able to go out and seek grant opportunities in this last year. Prior to that, we just didn't have enough staff to be able to even explore the grant opportunities.
So we don't have a lot of historical perspective
We
on
don't.
that.
The federal aid, that's something that the county general fund does receive every year. That's not part of our budget, but I wanted to express that because of the expenditures that we have on our side, the county general fund receives those dollars as well.
Okay, thank you.
Anyone else? Yes.
Yeah,
Commissioner Mills?
I just thank you. I also wanted to express my gratitude at the presentation and the clarity there and the level of detail. And I think we all knew the impacts of taking on the public health educator position, and we can see that now in the budget. And I just wanted to point that out because I still believe that by spending dollars in this way, we're helping get ahead of any future costs by doing the public health education, and whereas it is a significant cost right now, I do believe it'll still have a significant impact into the future. So, just wanted to point that out and recognize that significant cost. But right now I don't have any other questions, but more may come up as we discuss. Thank you.
I do have a question, and it's about the fund balance. So in July of '20, the county board passed a fiscal policy that recommended that the public health department, I think, have a 30% fund balance, which I thought was low. And now we're at 70%. And I'm looking at what we have added to fund balance over the last 3 years, which is quite huge. And I'm wondering why we maybe don't look, again, trying to use maybe more of that to bring that down, because I happen to know that in our regular county board meeting, we're going to have some other budget proposals increases. And as a commissioner, I have to make a decision, where's the best use of money? And I think housing right now is huge. And we're going to have some proposals that are coming before us that we're going to have to make some decisions on. And do we want to keep adding to our fund balance when we are well over what is recommended? Or should we maybe cut this somewhat and move it over to a place where we can spend it on housing? So, can you talk about that and how you made that decision?
I can. I'd like to make a clarification on the Budget Committee recommendation of 30% for PHHS fund balance. The reason why the state auditors have told us 42% is because we rely so much on the levy for our funding that property tax collections occur, the first half of the year occur in May. By the time the auditor's office is done collecting those funds and then distributing them to the different departments, it's June, which means we need to cover our first 5 months of the year for our own costs. 5 divided by 12 is 41.67%. That's where the state auditors say you need to hold a minimum of 42% of your budget in a fund balance. The PHHS fund balance is completely separate from the general fund balance. This is our fund balance in our area. If we're given a direction to indicate a higher usage of the fund balance in our budget, I would certainly bring forth those numbers and show you what those would look like, if that's something that you desire to see.
Well, I would like to have some discussion on that because, like I said, we're using other people's money here and we can't just think public health and human services department. We have to look broader of what's going to be coming in front of us and make the decision of how much do we want to increase our overall levy and what's the best use of those funds. Right now, is it sitting in a bank somewhere, or is it using it for what we need right now and use other funds for our housing issues that I know are going to be coming before us? Another thing that I have a question about, so we'll save that, but maybe we can bring this in. So we approved the SHIP increase. It was supposed to end in December. That was how it was presented to us. But now we're just going to continue that forever, even though our funding for that has not increased? Is that correct?
So we're representing the increased position in our preliminary budget. That would be dependent on board action, approving the contract as with any other of the proposals that we've introduced before you today. So you wouldn't be acting on that contract. We're representing it in the budget under the assumption that we'll be presenting that as a recommendation again next year.
So if we approve this budget, when we get to that point, we're kind of just saying we're approving extending that contract. Is that
in terms
how
of
this
the
works?
fiscal impact is represented in our draft budget, but over the course of the next several months, as we continue to receive more information on some of these pending grant opportunities, again, those changes will be reflected in our budget in the form of modifications and updates to the PHHS board.
Thank you. I just need to learn the process here. I don't know. I have another question about the home visiting. I noticed that our revenue for home visiting is quite a bit lower, and there's 2 home visiting programs in the expenses.
We no longer have the home visiting program under our umbrella here because we don't have a public health nurse that goes out and conducts the home visiting. So that's contracted with Sawtooth Mountain Clinic, and there are 2 complete separate programs that are funded. We are the fiscal host of those fund grants, or I'm sorry, for the evidence-based home visiting, we are the fiscal host, meaning we get the grant funds and we pass them directly to the Sawtooth Mountain Clinic. So we no longer receive any revenue. When somebody was going out and conducting home visiting visits with clients out in the community, if the clients had a particular health insurance that would cover some of the costs, then we could bill those health insurance. But because we are not the ones that are doing that anymore, when the clinic is going out and doing those services, they are the ones that are applying for reimbursement through those health insurance companies, and they're the ones that are receiving the revenue. And it offsets the cost that we are paying them then. The second home visiting program is the universal home visiting program, and that one, when we no longer were doing that in-house here, we contracted with Sawtooth Mountain Clinic to do that, and we are paying them to do that. And those are county funds for the universal family home visiting. I have to know the acronyms.
That's another increase from 2021 then, right? That's what I thought that looked like.
Let me take a look.
I didn't write down the page number for that one.
The 2021 budget for universal family home visiting was $43,000. In 2022, we are projecting $33,000 for a $10,000 decrease. That $10,000 then becomes the oral health task force.
Okay. But our revenue doesn't show, only shows the one evidence base. That's the only thing.
Correct.
We
We
get.
do not receive funding for the universal universal family home visiting.
Okay, thank you. Anybody have any comments about fund balance use?
Well, I just want to recognize that as a first blush, is that the, thank you. I think I go before flush and blush, and then as the first blush, a 2.5% change in the budget for PHHS, I think, is very low. And I want to appreciate the sensitivity with the numbers here and the nuances in trying to navigate, and as Commissioner Hawkins said, try to balance all of this, because it is a very, very difficult dance with many factors in our community that we cannot predict and need to react to and need to pivot frequently, just based on whatever's happening in our local community or potentially nationally or internationally. And so I like that there is some use of fund balance in the budget there. And I also like that it's not using all of it, that we're trying to be conservative with the use of fund balance, recognizing that we can certainly use it, but that we may very well need it in the future as well. So I think right now what's proposed is a pretty good balance. And as time goes on, as Allison pointed out, we're going to be getting more information and just see how things sift out, and then we'll get updated and see how that works into the balance as well. So that's my general first blush at all of this.
Lori, I have a question. With the use of $100,000 from the fund balance, what percentage, could you clarify, of the fund balance will we have remaining?
The potential for 73% of the
73%
of the fund balance towards our against our expenses.
Okay.
Where right now we'd be sitting at 74%.
Thank you.
And a part of where I'm coming from too is maybe just being really sensitive and cautious to where we've been as a department in the past and how difficult it was to get out of that hole. And so that's where I feel like steady as she goes, and yeah, and so it just makes me. But I do want to recognize, yeah, we're healthy for sure, but I'd like to keep it that way as much as we can, and if we can do that with what I consider at 2.58% levy increases for the department, or that levy request increase, I feel like that's, what's the word? It's many things, but it's responsible.
And I just think about the potential grant funding, which we know is not guaranteed, but some of that it's pretty likely. And so that's where I'm like, okay, that's an opportunity to figure that into our budget, and if we don't need to use if that covers, that's why I'm a little more okay with maybe another 100,000 out of the fund balance, I certainly don't want to bring it down to below 50%.
Yeah.
I don't think that's wise, but I think we have some room in there to think creatively about how we are going to think about the whole organization and the levy and how that will fit together.
If the board would allow, I'd just offer a
Go ahead.
suggestion. Before the next PHHS board meets later this month, if you want to, I can put together what the use of fund balance would be to bring us down to a 0 increase, just for the sake of knowing what that number would be, to show a 0% levy increase. I do want to comment, though, on the opportunities for all these different grants that we have. The reason why I didn't include any of them in our proposed revenue stream is that, with the exception of the federal aid and state program funding, the rest of those, they're competitive grants. So there's several people that are in our same boat that are all vying for the same dollars. But I could certainly show you another scenario of numbers if that's something that the board would want to see.
I would like to see that.
And then at the meeting later on this month, then you will also have our July financial statement. You'd be able to see where we're sitting at.
Yeah, that would be
Okay.
helpful. I'm a numbers person. I need to see it laid out and see what the
Absolutely.
choices are and follow. Any other?
I have a question. On the housing, you brought up the idea that there will be people coming in with housing grant or money requests. Can any of the Public Health and Human Services fund balance be used toward housing, given that housing is a public health issue?
I think that's a big question that we would need more specifics to be able to address. What type of housing need would be proposed, and is our fund balance, even though it is significant in regards to our overall budget and the amount recommended by the state auditor, the needs in our community are far greater than even our department fund balance could make a meaningful difference in. And I think one of the ways that we've committed to addressing housing needs in the community is through that public health lens and looking at housing as a health issue, and how can we invest in staff time to engage more deeply with people who are most disproportionately impacted by housing as a basic human right and health issue. So in terms of additional development, I don't know that our fund balance, I would be very hesitant to.
So at this point, we don't know how much PHHS funds would be available towards the housing issue. Is that correct?
I think I would need more specifics in terms of what your question is.
I'm just wondering, with the, given that housing is such a major issue and we're all considering it a public health issue, I'm just wondering what funding would be available for these other programs that Madam Chair mentioned, and just trying to figure out if anything within PHHS would be able to help that. And it sounds like we don't have enough information at this time, which is fine.
And I think certainly in terms of having staff involved in what's happening at a local level with the potential development of an HRA, and how can our staff be a part of that conversation to help support moving things forward as a community.
Sounds good.
As well as the Healthy Housing Grant. And again, to Commissioner Mills' point, having those opportunities to seek out more grant funding by having stable staffing levels to find other ways to bring in revenue to address needs locally.
What does the Healthy Housing Grant cover if we get it?
Yeah, so the Healthy Housing Grant is a Minnesota Department of Health competitive grant that would train one of our public health educator staff in being able to go in and conduct in-home assessments to look at health risks in the home, whether it's falls, radon, smoke detectors, things that impact people's health in the homes that they're currently in. So that isn't going to be a capacity building grant in terms of housing availability, but looking at the potentially unsafe housing situations that people are in due to the overall lack of housing access in our community.
Thank you, Madam Chair. I was just going to also say, my impression is that we don't have a mechanism in place to work that way. But as Allison said, with our public health educators, hopefully we can help address that and help identify ways that we can, as an organization, be more impactful. So, so it's kind of an indirect use of it potentially, but as far as throwing dollars at a housing project per se, that's I'm not aware of any mechanism for that in the department. So it would be a whole nother position or system or whatever.
That clarifies what I was wondering. Thank you both. All.
Any other comments or questions?
I just have a comment in terms of next steps as a department beyond what Lori and I have shared already. We will be presenting our budget proposal to the Public Health and Human Services Advisory Council at our next regular meeting in September to get input and ask for a motion and recommendation as well. That's one of the statutory responsibilities of our advisory council, is to advise the department and pass a formal recommendation to the PHHS board regarding the budget. So there may be additional feedback at our September Public Health and Human Services Board meeting from the council.
Thank you. Okay, well, like I said, thank you so much for all this work, and I appreciate the detail that you went to lay this out for people like me.
One more thing, if I may,
Yes.
Commissioner Hawkins. Later this afternoon, a subcommittee of our Public Health and Human Services Advisory Council is meeting to review the process for the Public Health Fund grant making for 2022. So this would include those grants to community nonprofits and service agencies who support our mission. So we will be meeting to review the request for proposals, application materials, scoring criteria, and just the general process for our 2022 budget. But that is represented in our overall department request. I believe Lori shared it was a 2% increase over last year, which is consistent with what we have budgeted since the commissioners granted authority to our advisory council to make those funding recommendations.
Do we have a set of guidelines that was given out for how you decide who gets that funding?
We do, yes.
Can you send that to me?
Absolutely.
I won't have to search online for
Absolutely.
looking for it later.
So we ask that any proposals align with our community health improvement plan goals.
And do you have a score sheet? So
We do.
Okay, all right. So yeah, I'd like to see it just because I'm curious. So.
I can share last year's materials with you as we're actively updating the materials for 2022.
Thank you. Okay. Nobody else has any more questions? I think we're ready for a motion to adjourn.
So moved, Madam Chair.
Thank you. Do we have a second?
I will second.
All those in favor?
Aye.
Aye.
Aye. We are adjourned. Thank you.
That was easy.
Battery's not even fully charged yet. That's how fast it is.
Now you got to sit here a while.
Let's just pretend we're still working for a minute. Oh, God.
So early afternoon.
No, I do that too often.
Late afternoon.
Pretend I'm doing
all
chores
Monday
a
now.
lot. But at work, I'm actually pretty focused, surprisingly. Pretend I'm cleaning downstairs.
We
Then
can
they
just
come down and
email
they're like,
maybe
nothing's
some
cleaned up.
ideas
I'm
of
like,
either
oh.
where to meet.
I'm starting. I'm just getting organized.
There was a lot of mess.
That's preliminary assessment.
Okay. Have a nice day.
You too.
You as well.
Good to see you.
Week.
See you next,
Right.
Yeah, it's
I'm so
early in the
used to-
week.
Yeah. Have a nice day.
see you next Tuesday.
Thank you, Lori. Great job.
Advisory council, the one you had?
Yep. I'm only getting through tomorrow. Tomorrow at noon is as far as my brain goes, and I'm going on vacation.
Good.
Oh, wow. Have a good one.
12:30.
Are you traveling or
No
are you?
need
I'm
breaks.
driving to Washington Island, Wisconsin.
Oh, sure.
I'm camping. Very camping.
There we go.
Well, have a day.
My darndest. You as well.